to repeal it and put in place sensible reforms that truly do bring down costs. Madam President, I yield the floor. I note the absence of a quorum.
Clerk will call the roll.
Mr. Akaka.
Madam President,
The senator from Utah.
I ask unanimous consent that the quorum call be suspended.
Without objection.
Madam President, I rise today to speak about the Supreme Court's ruling this morning in the case involving the constitutionality of the Affordable Care Act's individual mandate. In that case, the Supreme Court rendered a decision that may be spun by many, perceived by many as a victory for the proponents of the controversial individual mandate contained within the Affordable Care Act. I submit today, however, Madam President, that this victory, if it is to be called that, will prove to be not only hollow, but also short-lived. I say that because, significantly, the Supreme Court was able to uphold the constitutionality of the mandate only by a series of gymnastics that allowed the court to find that this was a tax. First, the court addressed the issue and concluded, for only the third time in the last 75 years, only the third time since 1937, that Congress had in fact exceeded its power as asserted under the Commerce Clause of the U.S. Constitution. Having concluded that Congress lacks the authority to compel commerce, the creation of commerce, so that it could then regulate commerce, the Supreme Court went on to shoehorn this individual mandate provision into the Supreme Court's conception of Congress's taxing power. This awkward construction is one that exposes many of the true flaws of the individual mandate. The mandate itself, we must remember, was not wildly popular among the American people at the time it was enacted. It has become even less popular as the American people have come to understand it. A recent poll revealed that roughly 74% of Americans don't like the individual mandate. This is easy for us to understand when we think about the fact that we as Americans were born as a free people. We were intended to live as a free people. It offends our most basic sense of freedom to have one of the most personal decisions made for us by government, particularly by the impersonal, distant government that's based in Washington, D.C. These kinds of decisions should be made by individuals and families in consultation with their doctors, not by government bureaucrats in Washington, D.C. So the fact that it's unpopular doesn't surprise us, and given the fact that the Supreme Court was able to uphold the individual mandate only by calling it a tax is very significant. It's especially significant given the fact that it was pitched to the American people as something other than a tax. The President promised us he would not raise our taxes. He promised us that the individual mandate did not amount to a tax increase. He promised us all along that he would never raise the taxes of any American earning less than $250,000 a year. Well, those who participated in Congress, who voted for this provision, also promised us that this would not amount to a tax increase. They did so for one simple reason. They knew it couldn't pass. They knew it wouldn't be able to get the number of votes necessary to make it become law if they called it a tax. So they didn't. They went to great lengths to make sure that it wasn't described or characterized or structured as a tax within the text of the statute itself. Now, after the fact, the Supreme Court has taken the step of shoehorning this regulation into Congress's taxing authority, and it's calling it a tax, effectively insulating those members of Congress who voted for it from the political liability attached to having voted for a tax increase. Not just any tax increase, but a tax increase that the Joint Committee on Taxation has concluded will be borne overwhelmingly by hardworking middle-income earners. In fact, they've concluded that over 75% of the burden associated with this thing that has now been deemed a tax will be paid by those earning less than $250,000 a year. It was unpopular before we were told it would be deemed a tax. Now that it's a tax, we can't expect that its status as a tax will enhance its popularity. If anything, we can expect that it will become even less popular with the American people. For that reason, I'm absolutely convinced that for those who call this a victory for the individual mandate, it will prove to be anything but a victory. It will prove to be something that will result in a groundswell of people contacting their members of Congress, telling them that they don't want their taxes raised, telling them that members of Congress who voted for this promised them that it wouldn't be a tax increase, asking them, for instance, to vote on it, to decide once and for all whether they're willing now to call it a tax, given that that was the only way in which it could be affirmed, upheld as a valid constitutional exercise of Congress's power. Now, as we move forward to the November elections, we're going to hear a lot about what people don't want out of their national government. We'll continue to hear a lot from those people who are offended by this notion that the government can tell them where to go to the doctor and how to pay for it, who are offended by the notion that government would step in and tell Americans, you have to buy health insurance, not just any health insurance, but that health insurance which Congress, in its infinite wisdom, has deemed necessary for every American to purchase. And if you don't, you're going to be penalized. If you don't, you're going to be taxed. People are going to be upset about this. They're going to complain to Congress and to candidates for Congress. They're going to complain to the President and to other candidates for the presidency that this is not the kind of government that they want. After they do that, they'll proceed and they'll start talking about what kind of government they do want. That's where we have to move, away from the kind of government we don't want, toward the kind of government that we do want. The kind of government that we do want is today, in so many respects, the same kind of government that we as Americans have always wanted, ever since our founding. That is a government that at the national level recognizes limits to its power, recognizes that whenever government acts, it does so at the expense of our individual liberty. And when the federal government acts to a significant degree, it does so at the expense of our state governments, governments which are closer to the people and often more responsive to the needs and to the evolving demands of the people. This is not simply a technicality upon which we are involved in a discussion. This is a very important part of the political process. It's essential that any time we raise taxes, we do so in a way that is clear to the people, that we stand accountable for raising taxes to the people. The courts don't have the expertise to do that, and yet they exercise that power today. As the majority opinion today reminded, the Supreme Court of the United States possesses neither the expertise nor the prerogative to make policy judgments. Those decisions are entrusted to our nation's elected leaders, who can be thrown out of office if the people disagree with them. This reminds me of one of my favorite quotes from our country's greatest founding father, George Washington, who said something very similar way back in 1789, when he explained, "The power under the Constitution will always be in the people. It is entrusted for certain defined purposes and for a limited period to the representatives of their own choosing. And whenever it is executed contrary to their interest or not agreeable to their wishes, their servants can and undoubtedly will be recalled." This reminds us of the fact that we as Americans are in control of our own destiny as a nation. We as Americans are here and have the prerogative to explain what we want and what we don't want out of our government. The government exists to serve the people and not the other way around. The decision rendered by the Supreme Court today, while something that I disagree with in many respects, is one that I predict will usher in a new era of robust debate and discussion over issues of federalism and individual freedom. That debate, I'm convinced, will lead inexorably to the result that we as Americans will become more free, less captive to a government that tells us where to go to the doctor and how to pay for it, that we as a people will again prosper as we regain our God-given right to constitutionally limited government. Thank you, Madam President.
The Senator from Maryland.
Madam President, I rise to speak on the Affordable Care Act. Madam President, today I am so relieved that the Supreme Court has upheld the Affordable Care Act as constitutional. With this ruling, our nation's highest court has made it clear that no matter who you are, a man or a woman, a senior facing cancer, a child with juvenile diabetes, will have health care that's available, reliable, and undeniable. Health care reform has achieved many goals that the American people wanted us to do. One, expanding universal access. Now 32 million people will have health care that they didn't have before. Second, it breaks the stranglehold of insurance companies, ending their punitive practices, particularly in those areas of pre-existing conditions where they denied health care because a child might have autism or asthma, or for we women, they had a particular approach where they charged us more for men of comparable health status, 30% more, and then they treated simply being a woman as a pre-existing condition. Pregnancy, sometimes the need for a C-section. In some states, being a victim of domestic violence was considered a pre-existing condition. We ended that practice. We also saved and strengthened Medicare, and we emphasized prevention, early detection and screening that will save lives, improve lives, and also save money. I'm proud of what we did in Congress with the universal coverage. For the first time in our history, we are committed to covering every single American with health care. And it helps young families be able to look out for their children. It helps young adults recently graduated from college, some looking for a job, some working in startups where there's no health insurance. Because of health care reform, 52,000 young adults in Maryland will have coverage on their parents' policy while they go back to school, look for a job, or get that entrepreneurial spirit going. And then there's these punitive practices of the insurance company. Much is being said about how we interfere with your right to see the doctor, your doctor of your choice, or get health care. Well, that's what insurance companies have been doing for years. People in pinstripes sitting in boardrooms made, decisions on who could get health care and who couldn't. So we've stopped them from denying family health insurance. We stopped insurance companies from denying children's coverage. And Congress ended, as I said, the discrimination against women. I remember when they tried to take our mammograms away, and I just said no, and organized the Preventive Health Care Amendment. But when we women fought to have access to mammograms and other things related to our particular life needs, the fact is that we wanted it for the men too. So when we organized for the Prevention Amendment so that we could limit the need on co-pays for this, it was so we women could have access to mammograms, so that the men could have access to the screening for prostate cancer, so all Americans could get that screening for the dreaded C words like colon cancer. How about diabetes and heart disease? These are the kinds of things that if you can have early detection and early screening will save lives and also stay the spread or the disease getting worse. Takes the terrible situation of diabetes. Undetected, uncontrolled, and unmanaged, diabetes can result in the loss of an eye, the loss of a kidney, the loss of a leg, all because you've lost your health insurance. But because of what we've done in the Affordable Health Care Act, not only will you have health care, but you'll have the preventive services where early on you'll be able to examine exactly where you are, have access to a diabetic educator, have the kind of monitoring and coaching that you need, and hopefully diabetes comes under control, and guess what? Our health care cost comes under control. That's what we did in this bill. and I'm really, really proud of it. I travel my state a lot, and as I went from, diner to diner out there in the community where I could just talk to the people unfettered, unprogrammed, unchoreographed, what they said to me was, Barb, I not only worry about losing my job, but I worry about losing my health insurance. I don't know what will happen to my family. I fear that I am one health care catastrophe away from family bankruptcy. I want to make sure that my family's taken care of. And I talk to small business. How could they afford that? They need predictability. They need understanding, and they need to have access through something called the health care exchange, where it'll be like an economic mall, where they will be able to go to the health exchange and see the whole lineup of private health insurance companies and the benefit that they offer. So small business will be able to navigate that and see what do they need, what can they afford for the benefits for their workers. This is the American way. This does use market techniques, but at the same time, we don't use a free market to endanger the people in terms of universal access and some of these others. And there are many things to this bill, and one of the other things that I liked so much was that we insist that 80% of the premium you pay goes into health care, not into the executives' pockets for perks, privilege, or profits. Now, I believe in the free enterprise system, and I believe in profit, but I don't believe in profiteering. So we said 20% goes into administrative cost, and if you can control those, you'll make a bigger profit. But 80% has to actually go rewarding providers for the health care that they do, for their education, for their training. I just think it's terrific. And this August, this part of the bill is already kicked in. My constituents in Maryland will see over $5 million returned to them because we insisted in this provision. So we are for providers getting what they need in terms of reimbursement, but at the same time looking at making sure it goes into the health care that they need. So today we've had the ruling of the court. I was out there on the steps of the Supreme Court, and I loved every minute of it. Madam President, as you know, I got into politics as a neighborhood protester. I fought a highway, and I fought the downtown establishment, and I fought the political bosses. And what I've said is I've talked to young people around the world, particularly those who have aspirations in autocratic or dictatorial environments, that, in America, when you're a protester, they don't put you in jail, they send you to the Senate. I'm here because of the First Amendment of the Constitution, free speech, freedom of assembly. But when I was out there on the steps today and heard the roar of the crowd, whether it was the Tea Party who had access to a microphone, whether it was me who had access to a microphone, that the founders' vision of America worked. What did they do? They believed in limited government. They believed that they believed in checks and balances. No president should have unlimited power. No Congress should have unbridled power, and the Supreme Court would be an independent judiciary to act as the referee. President Obama proposed the bill. We duked it out in the Congress. We passed it and sent it out to the land, but there have been legal challenges. It went to the Supreme Court. The Supreme Court looked at the bill, not for utility or even desirability. They looked at it for constitutionality. And today they ruled that the bill was constitutional. I'm sure somewhere there's Tom Jefferson, John Adams, and his wife Abigail, who said they lived the Constitution, and in that health care bill, by the way, John, they didn't forget the ladies. Madam President, I yield the floor. I note the absence of a quorum.
The clerk will call the roll.
Mr. Akaka.
senator from Maryland.
Madam President, I ask unanimous consent that the quorum poll be dispensed with.
Without objection.
And Madam President, I ask unanimous consent to speak as if in morning business.
Without objection.
Madam President, I take this time to comment on the Supreme Court decision on the Affordable Care Act. I think this was a good day for the American people. It allows us to move forward with providing universal health care coverage for all Americans, affordable quality health care. I want to quote from a former member of this body when he said, "For me, this is a season of hope, new hope for a justice and fair prosperity for the many and not just the few. New hope, and this is the cause of my life, new hope that will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent quality health care as a fundamental right and not a privilege." That was a statement from our former colleague, the late Senator Ted Kennedy, on August 26, 2008. This Congress acted and did what was right to move this nation forward, to join all the other industrial nations in the world to say health care is a right, not a privilege. And the Supreme Court today recognized that it was Congress's responsibility and that Congress had the legal authority to move forward. As a result of that decision, we're going to find that $10.7 billion has been recovered already today by dealing with waste, fraud, and abuse in the Medicare system. We'll be able to continue with those programs that make our health care system more affordable. We'll be able to continue health care coverage for those between the ages of 19 and 25 that are now on their parents' health insurance policy. 3.1 million young adults have benefited from that provision of the Affordable Care Act that was upheld by the Supreme Court today. 17 million children with pre-existing conditions can no longer be denied coverage by their insurers. That provision is now safe as a result of the Supreme Court decision. 5.3 million Americans on Medicare have saved on average $600 on their prescription drug. Madam President, as you know, we worked in this Affordable Care Act to close the coverage gap, the so-called donut hole on prescription drug coverage for our seniors. In upholding the Affordable Care Act, the Supreme Court allows us to continue to make sure that that coverage gap is eliminated. 70,000 Americans with pre-existing conditions now have the security to know that their coverage is safe. In addition, in 2011, 32.5 million seniors received one or more free preventive services. So far in 2012, 14 million seniors have already received these services. The expansion of benefits in Medicare that was under the Affordable Care Act, providing the wellness exam, eliminating the co-payments on preventive health services, that will also now be safe, that our seniors will continue to be able to enjoy those benefits. On the donut hole that I already mentioned, the coverage gap on prescription drugs will save $3.7 billion for 5.2 million seniors on an average of $651. This is real money. This is a difference between some seniors being able to take their medicines or having to leave them on the pharmacist's desk. That is now also protected. Insurance companies will provide almost 13 million Americans with over $1 billion in rebates in 2012. We put into the health reform proposals protections against excessive premiums by private insurance companies. Well, that's going to save the consumers in America over $1 billion. 105 million Americans no longer will have lifetime limits on their coverage. Insurance should be there to protect you. Before the Affordable Care Act, we had limits that may not have covered your extraordinary costs, your catastrophic costs. We now have that protection as a result of the Affordable Care Act and the Supreme Court upholding that decision today. It's also important for small businesses. Small businesses, 360,000 took advantage of the tax credit that helps small companies afford to buy health insurance for their employees. And when we fully implement this bill in 2014, small companies will enjoy the same larger pools and lower premiums that larger companies enjoy today in covering their employees. That today is helping cover around 2 million workers. So we already made a significant amount of progress as a result of the Affordable Care Act and the Supreme Court upholding that law today. I'd like to just talk a minute about the Patient's Bill of Rights. You know, one of the major parts of the bill was to take on the abusive practices of private insurance companies. We all know that that was at risk if the Supreme Court did not uphold the actions of Congress. As a result of upholding the actions of Congress, we now find, for example, access to emergency care, a provision that I worked on, that says that if it is prudent for you to go to an emergency room, let's say that you're having shortness of breath and you have chest pains, and the right thing for you to do is to go to an emergency room, that your insurance company is going to pay for that visit. They can't go by your final diagnosis. That may not be a heart attack, but after you get your bill and it's not paid for by the insurance company, you might have a heart attack. This bill protects us. The Affordable Care Act protects you to make sure the insurance companies do not use abusive practices against you. The access of women's health care is guaranteed under the Patient's Bill of Rights. Access to pediatric care, choice of health care professionals, all, as your primary care, all that is in what we call the Patient's Bill of Rights that protects you against abusive practices of private insurance companies. Clinical trial coverage is also in here, a provision I worked on health disparities. We know that we pay a heavy cost in America because of health disparities in minority populations and in gender issues. We now have a National Institute for Minority Health and Health Disparities at the National Institutes of Health. That will help us understand why we have these disparities in our system and what we can do to reduce those disparities because it's the right policy for America and will also save us money. That law now is protected. That institute is protected and is no longer in jeopardy as a result of the Supreme Court upholding the Affordable Care Act. And then let me talk about oral health care. We've talked frequently on the floor here about the Monty Driver, the 12-year-old in Maryland in 2007, had no health insurance and could not get access to dental care, lost his life. We said that's not going to happen again in our state or any place in the nation, and we're proud that children's access to pediatric health care, dental care, is protected under the essential benefit provisions in the Affordable Care Act that was upheld by the Supreme Court today. I also just want to comment on the importance of the legal decision beyond health care. To me, it shows that the Supreme Court was able to find a way to advance the rule of law and to follow the precedent that we've seen in upholding programs such as Social Security and Medicare, which are mandatory insurance programs. It's the right decision on the rule of law. It's the right legacy for this Court to find a way in the Supreme Court that has 9 different justices with different views. They were able to come together with an opinion that upheld the authority of Congress to act on a major national problem. Madam President, now it's time for us to move forward. This issue has been litigated. The Supreme Court is the final arbiter of the decision. It is constitutional. I urge my colleagues, both Democrats and Republicans, let's work together to implement this bill in the best manner for the people of this nation. We know that we're saving money. We know that the Congressional Budget Office says that the implementation of the Affordable Care Act will save hundreds of billions of dollars over the first 10 years, and then trillions of dollars beyond that in our health care system. Let's work together to make sure it works. Let's work together in the interests of the American people. Let's put our partisan fights aside. Let's accept what the Supreme Court has done, and now let's move forward to get this law implemented in the most cost-effective way so that we can indeed achieve the goal that Senator Kennedy was talking about, that every American should have access to affordable, quality care in the richest nation in the world. And with that, Madam President, I would suggest the absence of quorum.
Clerk will call the roll.
Mr. Akaka. President.
The senator from New Jersey.
Thank you, Madam President. Today is...
The Senate is in a quorum call.